Okay, so who was first on the list? I
Was
don't.
it me? I think it was me. Yeah. Okay. So mine was the prevalence of lateral ankle sprains in whatever population. So when I Googled it for on Google Scholar, it gave me that basketball players and football players were the most prevalent to ankle sprains. So they kind of went through a checklist um, and asked like the history, maybe injuries before, or maybe reoccurring ones with the ankle sprain. And then it said also that 48 basketball players and 58 football players were in the age range of like 19 years old that they that participated in it. Um, so the sprains were more prevalent in basketball players on their dominant leg. So then when it comes to what we can do for athletic training or trainers, we should take prevention action. So strengthen single leg balance, strengthen movements that cause ankle sprains, strengthen ankle range of motion, and maybe even neuromuscular changes. Well, I think that's the gist of it. Yeah. Yeah. Yep. That's about it.
Okay, I think I'm next. I went ahead and did the same thing. Like I Googled, scholared because I'd have risk factors for a lateral ankle sprain. And so I kind of just took notes on the whole article. So for like the introduction part, I just kind of summed it up. And they introduced what a lateral ankle sprain was, and it's an acute traumatic injury caused by excessive inversion or plantar flexion and adduction to the foot. The injury to the lateral ligaments could cause chronic ankle instability. In the article, they abbreviate it to CAI, and early onset post-traumatic osteoarthritis. And then people who are high risk for LAS, which was as a lateral ankle sprain, are athletes, but people have their own predispositions for the injury. So the next session or the next section of the article was intrinsic factors, and those were age, body composition, history of previous injuries, muscle strength, and postural balance. And the study found that ages between 15 and 19 are higher risk in males, and then 10 to 14 in females. For the body composition portion, it was found that people with a body mass index of 2.9 or 29.32, so overweight, are more likely to sustain a lateral ankle sprain. Muscle strength was also a factor. So athletes with weak hip and lower leg muscle strengths were at higher risk factors for getting a lateral ankle sprain. And then lastly, the postural balance was conducted using a single leg standing test. So basically they had a bunch of athletes preseason stand on one leg. And if they kind of use their arms for stability or put their opposite leg down, then they came out for positive, and then the other people were negative. So people who tested positive ended up with the majority of a lateral ankle sprain. And then for intrinsic risk factors, oh my gosh, athletes who participated in indoor sports are more likely to have a lateral ankle sprain. So like you mentioned before, women's and men's basketball are the two highest sports associated with LAS. And it was also found that athletes under the NCAA division have higher rate of LAS. And knowing the risk factors, like the intrinsic and extrinsic factors, allow ATs to properly train and then prepare, as well as educate athletes on ways to improve things like their strength and balance. And that's all I took notes of.
Okay, so I'm next. I had evaluation of a lateral ankle sprain. So the first step is getting a mechanism of injury, obviously. So how it happened, what they were doing. So if there are certain, so when you should suspect a lateral ankle injury, there should be, they would complain about, or sorry, oh my gosh. Their mechanism of injury would be rapid inversion or internal rotation, loading. So, and then for more, so the syndesmosis ligament, that's a more specific one that they went over. That mechanism of injury would be external rotation of the foot or eversion of the talus, or an excessive dorsiflexion. So the main ligament that usually gets injured is the anterior talofibular ligament. So, and then so the best test for that is the anterior jaw test. And then some other ligaments that are being looked at are calcaneofibular ligament. And so they would be complaining about the ankle joint combined with passive inversion there. And sorry, the anterior talofibular ligament, they'd be complaining about passive plantar flexion and inversion. And then they told us to quantify certain information. So pain, just giving them self-reported, patient reported pain, just a normal 1 to 10. And then swelling measurements, range of motion measurements, and then regularly taking it so that they kind of see like the progression. And then, yeah, that was then, but also muscle strength and the balance. So doing like star scoring system. I know we have this the star balance set up in the clinic, but that was pretty much it.
All right, so I'm next, and I had the rehab techniques for lateral ankle sprains. So the article that I read is called Rehabilitation of the Ankle After Acute Sprains or Chronic Instability, and I found that on PubMed. So pretty much what the article was about is about functional rehab program that progresses from basic to advanced. Some important considerations are ankle injuries, including controlling the acute inflammatory process, regaining full active range of motion, ankle range of motion, increasing strength and power as well. And there's different modalities like flexibility exercises, strength and balance training exercises as well. And they also listed like 3 different stages. Like the first basic stage was like just doing range of motion and training exercises. The intermediate stage is like doing progression and proprioception training exercises. And for the advanced stage, it's focusing on like sports specific activities that the athlete does so they can like return back into competition. And some lateral ankle sprains rehab techniques that they did was like the alphabet exercises, where like with your ankle you just draw out the alphabet. Plantar flexion, holding it for like 5 to 10 seconds. Dorsiflexion, also same thing for holding. Toe curls with the towel, toe raises, and heel walks. And there was other more, but those were the only ones that I pretty much got. And also like I read that we were supposed to write about how like it shows patient care. So pretty much just engaging with like the patients and their care plan, encouraging the patient to like ask questions so they can feel comfortable with you, and showing like, and pretty much teaching them about the condition they have and their treatment choices by showing them with like models and diagrams. And also addressing the patient's physical needs. So reminding the patients, hey, you need to like drink ibuprofen for the swelling and the pain, and also reminding them to do like rehab exercises at home. Also, I also read that we were supposed to like talk about like how it guides athletic training practice. So how it could guide is by practicing like showing techniques on different rehab types of like for ankles injuries. So like showing different kinds. So the article showed different kinds of like rehab exercises that you did. Like it was like a long article, like 25 pages long, and it gives like a brief description on how to take care of lateral ankle sprains as well as other ankle sprains as well, and which could give like a guide for like new athletic trainers on like what to do for ankle sprains. That's it.
Okay, so what I got from my article was to research something about preventing ankle sprains. So the article that I read was called a novel low friction device for prevention of lateral ankle sprain injuries in indoor sports. So basically they went over the mechanisms that cause lateral ankle sprains, and then they also connected it to like friction on the outside of the lateral ankle. So what I got from that was maybe like footwear could have to do with like preventing ankle injuries, as well as like taping, because I know taping was like statistically one of the main rehab modalities that athletic trainers use. I think it was like 45%. Here, like it just breaks down like the anatomy of the lateral ankle sprain. They connected to friction, and then they also tried to come up with like a new type of patch that would like attach to your shoe, like the outside of your shoe, to prevent friction. And I think they did like randomized what's it called? They did randomized studies where they tried using the patch, and it reduced severe ankle injuries by 53%. And then it also says that there was a 63% reduction in friction coefficient between the lateral edge of the outside and the outsole during like indoor sports. So maybe like not applying like that new invention that they tried to put towards athletes, but maybe like wearing like ankle braces and then learning how to tape properly to prevent the inversion and the eversion of lateral ankle sprains. So that's what I got from that. It was a peer reviewed article, so that way like it was pretty credible as far as like breaking down the like the anatomical mechanisms of the ankle. So that's what I got from it. So yeah, I think that's pretty much it.
Sweet. So then,
So does one person have to turn the